Okay, so we got Jenna here. And Jenna, just give us a little rundown about what's been going on and what we've been working on for you.
So my back has been hurting me, like the lower back, and my upper back, like by my shoulder blades. And then my knee, my right knee has been bothering me, and as well as my right ankle.
Okay. And Jenna's got kind of a special story because she had some trauma that happened to her knee and whatnot. So why don't you tell us a little bit about what happened to the leg and kind of what we've been working on to try and help the knee and whatnot.
So I was in a car accident in 2022, and I broke both of my femurs, and I had a stroke, so I lost function in my whole right side. And so my right knee is weaker because of the stroke and of the femur fracture.
And you had plates and stuff put in,
yeah,
right? Like a rod?
I have a rod and 2 pins per leg. And then my right ankle doesn't work 100%, and I can only turn it in so my foot isn't awake. And so since the ankle is weaker, the right knee has to be stronger. And so like it takes a lot more pressure, I guess. So.
And we've been kind of just working on alignment, trying to work on the ankle and the knee, and just trying to at least do our part to keep things in alignment for her, because as we do that, one, the nerve supply is clear to try and do the healing that it can, but two, you know, it's going to be easier to walk on a bad knee or a bad foot if the alignment's good. So has that been helping since we've been working on those two things?
Most definitely, yeah.
Good, good. A little bit right there. Let's go head down a little bit. I'm going to check the neck out too. Any problems in the neck today?
Mm-mm.
Good. A little swing up top that I want to check out. So the reading that I ran on her, basically we're looking for temperature changes. And so anywhere you see a green mark like that, we're just basically marking the spots where there's a little more swelling. So you definitely have more swelling at the bottom here again, and that's kind of typical for her. So just checking hip motion, SI joints here. And she seems to have more restriction in her tailbone, as well as swelling right there, a little tender there. Now at 5 up there versus S1 and S2.
S1.
Okay, so that's pretty typical of her. We'll do that sacrum again for her. And then we're just feeling along the spine, so we want to feel for swelling, any changes with the skin that can be kind of cluing us into any problem areas as well. 2 there, 4, 5, 6. So we'll poke on them. Tender on 6, 7, and 8.
6.
Okay, so 6 is our winner. Usually tenderness is a telltale sign that there's a problem there too, so subluxations usually have tenderness at the hips. Yep, a little more? Perfect, just like that. Come up like that. That'll work. There's our friend on the sacrum. We're going to go back with that arm. Nice and loose with that shoulder as I roll you, okay? Come my way a little bit. There we go. Good one. Alright. Let's make sure the hips are moving good after that. Yep, feels good. Let's get that T6. X-ray tells me to be on the left side, so we'll actually have a little bit of torque in there as well. There's a good one. Awesome. Alright. So I'm checking range of motion of the tibia, both on the outside and the inside. And there's a little bit of stickiness on that. So normally what we look for is a little more of a bounce. So at end range it should just kind of bounce off the end range and come back. And then we check up on the femur as well. And that's what we did last time actually, is a femur adjustment. The only thing I feel today is a little bit on the inside of that tibia. So, and then we'll check for some tenderness and swelling too. So. How are we doing there? Is that tender at all? How about up here?
Yeah, a little.
Not as bad as the bottom one, maybe?
Yeah.
Or are they about the same?
They're kind of the same.
Okay. Motion-wise feels good on the femur, just a little bit on that side there. So I've got to stabilize that femur up here, just so there's not a lot of play in there. We're going to be really specific with it because she's got hardware in there. And then the adjustment basically is coming down this way. The tibia is rotated up on that inside. So we're basically just rotating that tibia back through this one just a little bit. And you usually don't feel or hear a big clunk on this. It's just a little set like that. There we go. Good. So nothing too aggressive. We don't want to do anything crazy with the hardware in there. We just want to try and support that joint and make sure it's all good. And for that knee. So if she's, like right now, the ankle bone, this calcaneal bone here is slipped this way. So she's got swelling on this side and the joint's actually fixated somewhat this way. So the big thing for me is when I'm watching somebody walk, if I can tell that their foot is coming like this, one, you can look at their shoes. Like their shoes are actually going to be worn on the outside. She has pretty new shoes, but a lot of times you'll see them actually worn on the outside thinner, so they'll be thicker on the inside. But the other thing it does is it starts to make this tibia bone compensate. So usually we'll rotate this in to make sure that there's room for this foot to strike flat on the ground. And then the other thing that's going to happen is this femur is actually going to rotate the opposite direction to compensate. So the femur will then rotate this way. So they'll get a lot of pressure on the inside, padding of that knee, as well as it can cause problems with the SI joint later. So one, we worked on the tailbone. Two, we worked on the knee. Now we got to work on the foundation down here. And then we just let her body do the work to heal it. So nice and relaxed there. I'll pull this a little bit. There we go. One more on that. Real loose there. There we go. Good. It's flat a little bit better there. Okay. And the last one is this talus bone right in the middle of the ankle there. That's kind of the anchor of the ankle. Heel bone feels good. So Jenna, can I have you flip over then to your back? Just gonna tuck that right through this way. Loose there. Just a little bit. A little bit more. Let's see how we did. Nice and loose. Let me move that. Good on the inside. We still got a little bit on this outside yet that we're going to do. So one more real loose. I'm going to bring the toes up a little higher on this last one. There we go. Okay. Go ahead and walk for me if you would.